All right, today we are getting into a topic that so many of us deal with, acne. And look, it's way more than just a few spots on your skin. It's a real medical condition, and honestly, it's pretty misunderstood. So in this breakdown, we're going to get into what it is exactly, how it's diagnosed, and what you can actually do to treat it.
Pimples, blackheads, cysts. We throw these words around all the time, right? But what is acne, really? I'll tell you, it's not just a random breakout. It's a condition with different forms, and as you'll see, very different levels of severity. So yeah, let's dive in and get some real clarity on this.
Okay, so first things first, we have to understand exactly what we're dealing with. To really manage acne, you first have to know what you're looking at. So let's break down the different forms one by one. Let's start with the absolute basics, comedones. You probably know them better as blackheads and whiteheads. Now, blackheads, or open comedones, they're not dark because they're dirty. It's because the gunk in the clogged pore is open to the air and it oxidizes, kind of like how an apple turns brown. Whiteheads, on the other hand, are closed comedones, so the pore is clogged but sealed off from the air. These are your foundational, non-inflamed types of acne. Okay, now things start to get a little angrier. When one of those clogged pores gets irritated, it can turn into what's called a papule. These are those small, raised pink or red bumps you see. They're usually a bit tender if you touch them, but they don't have that classic pus-filled head yet.
And that leads us right to pustules, which, let's be real, is what most of us picture when we hear the word pimple. They're a lot like papules, but they're filled with pus, and that's what gives them that obvious white or yellow tip. This is a sure sign that there's inflammation and bacteria having a party in there.
And finally, we get to the most severe forms, nodules and cysts. Now, these are a whole different ballgame. They're not just on the surface. They're these large, really painful, hard lumps deep down under the skin. Cysts are similar, but they're filled with pus. And because they're so deep, the risk of them leaving behind a permanent scar is way higher.
And you gotta remember, this isn't just about how it looks. Acne can be physically painful. We're talking itching, real discomfort, and what doctors call erythema, which is just that persistent, angry redness and inflammation that won't seem to go away. So now we can spot the different types. But what does it all mean when you put it together? Well, figuring out the overall severity of the acne is the next critical step, because that's what's going to decide the entire game plan for treatment.
So it's really a progression, right? You start with mild acne, which is mostly those non-inflammatory blackheads and whiteheads. It bumps up to moderate when you start seeing more of those inflamed papules and pustules, and it's officially considered severe when those deep, painful nodules and cysts show up. And they don't just stick to the face, they can appear on your body too. You know, when you see it laid out like that, from mild to severe, it becomes crystal clear why trying to self-diagnose and just throwing random products at your face is such a bad idea. Getting a proper professional diagnosis isn't just a nice to have, it's absolutely essential. And this quote on the slide really just says it all. Basically, anyone with acne symptoms needs to see a dermatologist and steer clear of do-it-yourself therapies. I mean, think about it. That's not just advice, it's a pretty serious warning against accidentally making things so much worse. So, what's the #1 reason to go see a pro? It's simple. The main goal is to get the right treatment to stop permanent scars from forming. The right intervention at the right time can literally be the difference between a temporary problem and a mark you'll have on your skin for life. Okay, so we've identified the problem, we get why a proper diagnosis is so important. Now for the good part, the solutions. Let's get into the actual treatment options that dermatologists recommend, which are always tailored to how severe the acne is. This table lays out the whole strategy perfectly. See, for mild acne, the approach is usually topical. That just means things you put directly on your skin, like special cleansers or retinoid creams that help unclog pores. But when you get into moderate to severe territory, the treatment often goes systemic, which means oral medications that work through your whole body, like antibiotics or a very powerful drug called isotretinoin. And for some women, certain birth control pills can be a game changer for targeting hormonal triggers. But, what happens if the acne has already left its mark? What can you do about the scars that are left behind? Well, the good news is, modern medicine has some pretty amazing tools to help with that too. Yeah, laser treatments are a really powerful option here. Think of them like specialized instruments in a toolkit. You've got the CO2 ablative laser, which is the heavy hitter for deep indented scars. It basically resurfaces the skin to smooth things out.
Then you have the DY laser, which is different. Its job is to target the redness and inflammation in newer scars to help them fade away. The main thing to get here is this. There's a specific tool for a specific job.
All right, we've talked a lot about treatment, but you know what's even better than treatment? Prevention. So let's wrap this up with 5 key habits that anyone with acne-prone skin should absolutely, definitely avoid.
Think of this as your must-do or must-not-do checklist. First, stay away from comedogenic products. That's just a fancy way of saying stuff that clogs your pores. Second, and this is a big one, always take your makeup off before you go to sleep. Third, and we all know this is the hardest one, do not squeeze those pimples. I know it's tempting, but it can push all that bacteria deeper and cause permanent scars. Fourth, always protect your skin from the sun. And finally, keep an eye on your diet. Foods with lots of sugar and saturated fats have been linked to flare-ups.
So, we end with this simple but I think really powerful question. Your skin is talking to you. Do you know how to answer it? Because after all this, by understanding the what, the why, and the how of acne, you're not just guessing anymore. You're actually equipped with the knowledge to listen to what your skin is telling you and respond with the right care and the right professional help.